Have you ever wished you had a longer penis? If so, you're not alone. Studies surveying tens of thousands of men have found that nearly half, anywhere between 45% to 55%, express a desire for more length. That's 4 or 5 out of every 10 men. This wish is incredibly common, but what's less talked about is that most of the men who feel this way actually have completely normal penis sizes. As a urologist and pelvic surgeon, I've seen firsthand how anxiety about penis size can affect men's confidence, relationships, and even their sense of masculinity. I'm Dr. Reena Malik, and this discussion isn't about shame. It's about understanding the facts, separating myths from medicine, and learning what options actually work. Let's start with some science. What does average really mean when it comes to penis size? Research measuring thousands of men shows that the average erect penis length falls between 5.1 and 5.5 inches, about 13-14 female, with a normal range extending from about 3.5 inches to 6.5 inches. So unless you fall significantly below that, which is rare, you're likely within the normal range. A true medical condition called micropenis is defined as a stretched penile length of less than 2.9 inches, 7 centimeters, and it typically develops due to hormonal issues early in life, not because of anything a man does later on. Now, before anyone runs to grab a ruler, let's clarify how measurement works. In medical studies, penile length is measured from the pubic bone, not the skin surface, all the way to the tip of the penis. The ruler must press down to the bone to account for fat in the pubic area, which can mask part of the penis. Measurements can also vary depending on temperature, anxiety, and how aroused you are at the time. That means your size can fluctuate from one moment to another, and that's completely normal. It's also important to recognize how perception can distort reality. I often see patients struggling with what's known as small penis anxiety or penile dysmorphic disorder. These men perceive their penis to be much smaller than it really is, even when it's perfectly average. This isn't vanity, it's a legitimate psychological condition closely related to body dysmorphic disorder. It can cause immense distress, preoccupation, and even avoidance of relationships or intimacy. If this resonates with you, know that the solution isn't necessarily a physical one. Mental health professionals can help address the underlying anxiety, which often brings more lasting relief than any physical intervention ever could. Part of the problem stems from unrealistic expectations. And let's be honest, much of that comes from pornography locker room talk or the casual jokes we hear in media. These influences shape an idealized image of what masculinity should look like. And when men don't measure up to that impossible standard, they often feel inadequate. But as a doctor who has examined and treated thousands of men, I can confidently tell you that what's portrayed online is not representative of reality. That said, it's understandable to want to feel confident in your body, and there are practical evidence-based things you can do to improve not just the appearance, but the function of your penis. One of the simplest yet most effective methods is weight loss. Many men don't realize that part of their penis can be hidden beneath the fat pad that sits above the pubic bone, sometimes called the UPA. Losing weight reduces this pad, exposing more of the shaft that's already there. The result, your penis may look longer, even though you haven't added any actual tissue. To lose fat in this area, you can't target it directly, but overall body fat reduction through consistent exercise and a balanced diet will make a difference. Combining strength training with cardio and focusing on nutrient-dense foods, lean proteins, fruits, vegetables, and healthy fats supports hormone health and circulation, both essential for sexual function. Another simple but surprisingly effective trick, trim your pubic hair. When pubic hair grows thick or long, it can visually shorten the penis. Carefully grooming or trimming can make it appear noticeably longer. Just remember to do it safely, especially if you have diabetes or any condition that affects healing, as cuts in this area can easily become infected. Beyond the physical, anxiety reduction plays a big role too. When you're tense or stressed, blood vessels constrict, which can make the penis look smaller or less firm. Activities like mindfulness, meditation, yoga, or even just taking time for relaxation can improve your confidence and help you achieve better erections. If you experience chronic anxiety or difficulty managing stress, talk to your doctor. Mental health care is health care. Finally, maintaining healthy erections is crucial for preserving penile length and tissue quality over time. Erections aren't just for sex, they're part of how the body keeps penile tissue oxygenated and elastic. Men who don't get regular erections, especially nocturnal ones, may develop scarring in the erectile tissue, which can lead to shortening over time. So if you've noticed fewer morning erections or changes in rigidity, that's worth discussing with your doctor. There may be an underlying issue with blood flow, hormones, or nerve function that can be addressed. Before diving into more complex or costly treatments, it's essential to understand this. There's no miracle pill, cream, or supplement that can safely and permanently increase penile length. Despite what online ads may claim, none of these quick fixes have scientific backing. The internet is flooded with products promising instant gains, but they're often scams and in some cases even dangerous. What does work in certain cases are mechanical devices that rely on traction or vacuum pressure, and we'll explore those in the next chapter. At the end of the day, wanting to feel confident in your body is natural, but remember your worth, your masculinity, and your ability to be a loving, satisfying partner aren't defined by a number on a ruler. In most cases, the penis you have is perfectly normal, and with the right knowledge, care, and confidence, it can function exactly as nature intended. We'll look deeper into medical and non-surgical approaches that can make a measurable difference, how they work, and what to avoid. When it comes to penile length, much of what people think they know comes from myth, media exaggeration, and misinformation rather than science. As a urologist, I spend a lot of time clarifying what's real, what's possible, and what's risky. The truth is, there are no miracle pills or overnight solutions to permanently increase penile size, despite what countless ads on the internet may promise. But that doesn't mean you're powerless. Science has given us a clearer understanding of the anatomy of the penis, how it responds to certain interventions, and which techniques may safely support improvement, whether through better function, improved blood flow, or modest length enhancement. Let's start with what doesn't work. Pills, supplements, and topical creams marketed as penis enlargement solutions are almost universally ineffective. They may contain herbal ingredients like ginseng, ginkgo L-arginine, or yohim, which have been loosely associated with improved erectile function in some studies, but none have shown consistent or measurable effects on penile length itself. The improvement some men notice is often due to enhanced erection quality rather than actual growth. In other words, a stronger erection may make your penis appear fuller or slightly longer, but no pill can physically elongate penile tissue. Where we do see legitimate potential is in mechanical devices, specifically vacuum erection devices and penile traction systems. These tools rely on physics rather than pharmaceuticals. Vacuum erection devices, for example, use negative pressure to draw blood into the penis, creating an erection. This helps men with erectile dysfunction regain function and, in some cases, maintain or restore length after events like prostate surgery. Studies have shown that regular use, typically around 5 to 10 minutes twice daily, can help preserve penile tissue elasticity and reduce shrinkage that may occur after nerve injury or long-term ED. However, for otherwise healthy men, there's no solid evidence that vacuum devices produce meaningful or lasting increases in penile length beyond temporary engorgement. Penile traction therapy, on the other hand, has stronger scientific support. These devices gently stretch the penis over extended periods, encouraging tissue remodeling through a process called mechanotransduction, the same biological principle that allows tissues like skin and bone to adapt to prolonged tension. Clinical studies have found that consistent traction, often for several hours per day over several months, can result in average gains of 1 to 2 centimeters in stretched penile length. That might not sound dramatic, but it's a measurable, scientifically observed change. Importantly, this method is considered safe when done correctly. The key is patience and consistency. Newer devices, such as Restorex, have made this process more comfortable and time efficient, requiring only 30 to 60 minutes per day while still showing comparable results. For men recovering from prostate surgery or those with conditions like Peyronie's disease, traction devices can also help preserve length and reduce curvature. Another area of interest is injectable fillers. Though more commonly associated with facial aesthetics, hyaluronic acid as high fillers are now being used in some clinics for penile girth enhancement. While these treatments can increase circumference, they don't typically affect length. When performed by experienced practitioners using small incremental amounts of HA, results can look natural and last 18 to 24 months. However, fillers carry risks, including bruising, nodules, asymmetry, and in severe cases, infection or tissue damage. It's critical to understand exactly what's being injected. Some unregulated or permanent fillers, such as silicone or oil-based substances, have caused serious complications and should be avoided. I always encourage patients to prioritize safety and transparency over quick fixes. For those wondering whether hormonal treatments like testosterone or HCG can enhance length, the answer is no, at least not in adults. While these hormones play a key role during puberty, stimulating penile and testicular growth, there's no evidence that supplementing them after puberty leads to any size change. Hormone therapy can, however, improve libido, mood, and erection quality in men with clinically low testosterone, which may indirectly improve confidence and sexual satisfaction. Surgical interventions, while capable of producing visible changes, carry the highest risk and should be considered only after thorough evaluation and counseling. One such surgery, called suspensory ligament release, involves cutting the ligament that anchors the penis to the pubic bone. This can make the penis hang lower in a flaccid state, giving the appearance of added length. However, it doesn't increase erect length and can sometimes lead to instability during intercourse or even decreased rigidity. Post-surgery, patients must use traction devices to prevent scar tissue from reattaching the ligament, a process that requires discipline and careful monitoring. On average, studies report only about 1 to 1.5 centimeters of perceived gain, and satisfaction rates are low, with many men expressing disappointment given the cost, recovery, and risk of complications. A newer surgical innovation, the Penile silicone sleeve implant, has shown promising cosmetic outcomes in select cases. This FDA-cleared device is customized to fit under the penile skin, enhancing both girth and flaccid length. Early data suggests significant average increases in size, around 4 centimeters in length and 3 in girth, but the surgery isn't without risk. Complications like implant migration, infection, or erosion occur in roughly 5% of cases and can require additional surgeries. And while those numbers may seem small, if you're that one patient, the consequences can be life-changing. Fat grafting and dermal grafts are other surgical options designed mainly for girth enhancement. They involve transferring the patient's own fat or tissue to the penis, which sounds appealing since it uses natural materials. The downside: these results often fade as the body reabsorbs the grafted tissue. Patients typically see temporary improvements that decline over time, with long-term maintenance rates around 60% to 80% after 1 year. Like other surgeries, they also carry risks of unevenness, nodules, or infection. As we evaluate all these options, one thing becomes clear: any method that promises quick, dramatic, or risk-free enlargement should be viewed with skepticism. The penis is an organ with complex anatomy and function, and any attempt to alter it carries trade-offs. That's why I urge men to think deeply about their motivations. Are you pursuing a change because you genuinely believe it will improve your confidence or your sexual satisfaction, or because you feel pressured by unrealistic comparisons? Understanding the why is just as important as choosing the how. From a medical standpoint, the safest, most sustainable improvements in penile appearance come from optimizing overall health. Good blood flow, healthy hormone levels, and proper nerve function are the foundation of sexual wellness. Weight loss, regular exercise, and stress management all contribute to better circulation, more responsive erections, and consequently a fuller and healthier appearance. In the next chapter, we'll bring all of this together, looking at practical steps you can take to feel more confident in your body, improve your sexual health, and shift your focus from comparison to confidence. Because at the end of the day, what truly matters is not the number on a ruler, but how healthy, connected, and satisfied you feel in your own skin. After understanding the anatomy, the science, and the medical options for penile length, it's time to talk about something even more powerful: what you can actively do to improve your confidence, sexual function, and satisfaction starting today. Because while not every man needs a physical intervention, every man can benefit from better sexual health habits and mindset shifts that enhance both how you feel and how you perform. Let's begin with the foundation: blood flow. The penis is a vascular organ, meaning its function depends entirely on healthy circulation. Anything that affects blood vessels, like high blood pressure, diabetes, high cholesterol, or smoking, will directly impact erection quality. The healthier your arteries, the stronger your erections, and the fuller your penis will appear. This is why doctors often refer to erectile dysfunction, ED, as an early warning sign for heart disease. The same arteries that supply the penis also supply the heart. If you want to maximize blood flow, start with these essentials. Quit smoking. Nicotine constricts blood vessels, reducing oxygen and blood supply to erectile tissue. Within weeks of quitting, many men notice stronger erections. Exercise regularly. Aim for at least 30 minutes of moderate activity: brisk walking, swimming, cycling 5 times a week. Exercise increases nitric oxide availability, a molecule that helps blood vessels relax and widen. Eat for your arteries. A Mediterranean-style diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and nuts supports vascular health and testosterone balance. Manage stress. Chronic stress raises cortisol levels, which can lower testosterone and restrict blood flow. Mindfulness, deep breathing, or even 10 minutes of meditation daily can help your body and mind relax and improve arousal. Now let's talk about pelvic floor muscles, an often overlooked key to sexual strength and control. These muscles, located at the base of your pelvis, support the bladder, bowels, and penis. When they weaken, men can experience problems like premature ejaculation, difficulty maintaining erections, or reduced force of ejaculation. Strengthening them through Kegel exercises can make a significant difference. Here's how to start. Identify the right muscles by stopping urination midstream. Those are your pelvic floor muscles. Once identified, practice tightening them for 5 seconds, then relax for 5 seconds. Aim for 10 to 15 repetitions, 3 times per day. Gradually work up to holding contractions for 10 seconds at a time. Consistency is key. Studies have shown that men who perform pelvic floor exercises for 3 months can improve erectile rigidity, endurance, and overall sexual satisfaction. Beyond the physical, psychological confidence is just as important. Many men who come to my clinic don't actually have a size issue. They have a self-perception issue. Sexual confidence isn't just about how your body looks, it's about how comfortable you feel using it. One of the most effective ways to build this confidence is through mindful intimacy. This means focusing on sensation, connection, and communication during sexual activity rather than performance or comparison. When you're present in the experience, anxiety fades and pleasure increases. For men experiencing persistent anxiety or negative self-image about their penis size, cognitive behavioral therapy, CBT, has proven to be highly effective. CBT helps identify and challenge distorted thoughts, such as, "I'm not man enough," or "my partner won't enjoy sex with me," and replace them with realistic, empowering beliefs. Over time, this retrains your brain to feel more confident and relaxed, which often leads to improved performance and satisfaction. Sleep and hormone balance also play a massive role. Testosterone, the hormone that drives libido, energy, and erections, peaks during REM sleep. Chronic sleep deprivation can lower testosterone levels by up to 15% in just 1 week. Prioritize 7 to 8 hours of quality sleep each night. Keep a consistent schedule, minimize blue light before bed, and avoid heavy meals or alcohol late in the evening. Speaking of hormones, let's clarify one more thing. While testosterone replacement therapy, a TRT, can be beneficial for men with documented low levels, it's not a shortcut to enhancement. Overuse or unregulated use can suppress natural hormone production, shrink the testicles, and increase risks of blood clots or infertility. Always test, never guess, and only pursue treatment under medical supervision. Another key to both performance and appearance is body composition. As mentioned earlier, excess fat around the pubic area can visually shorten the penis by covering part of the shaft. Losing just 10 to 15 pounds can reveal up to an inch of hidden length, but the benefits go far beyond aesthetics. Fat loss boosts testosterone, improves stamina, and reduces the risk of ED. Combine strength training as to increase muscle and metabolism with moderate cardio as to improve heart health. If you're already doing everything right physically, but still struggle with confidence or arousal, it may be time to consider couples-based approaches. Research consistently shows that open communication about sexual preferences, insecurities, and desires leads to higher satisfaction for both partners. When men feel emotionally supported, performance anxiety drops and intimacy naturally improves. Remember, confidence in bed starts with connection, not comparison. Lastly, let's address the topic of expectation management. It's easy to fall into the trap of thinking that size alone determines pleasure, but that's a misconception. Most of the nerve endings responsible for female sexual pleasure are concentrated in the first third of the vaginal canal, not the deepest part. This means that for most women, emotional intimacy, communication, and foreplay play a far bigger role in satisfaction than penetration depth. Technique, empathy, and attentiveness matter far more than inches. To summarize, the path to feeling more confident and capable isn't found in a bottle, a quick fix gadget, or an unrealistic ideal. It's built on 5 pillars: optimized blood flow and vascular health, strong pelvic floor muscles, healthy body composition, and hormone balance, reduced stress and improved sleep, emotional connection, and realistic expectations. When you strengthen these areas, not only does your body function better, your mind becomes calmer, your confidence rises, and your relationships deepen. In the next chapter, we'll focus on how to maintain these gains long term, how to protect erectile health as you age, prevent shrinkage, and keep your sexual wellness strong throughout life. Because this journey isn't just about size, it's about lifelong vitality and self-assurance.